Hello everyone, welcome to Vasomedtech Heal Your Heart EECP Treatment Center. Today in this video, we are going to discuss about angina or chest pain, or in simple term, there is a lack of blood flow to the heart muscle and the heart is trying to get your attention by creating pain. So this is called chest pain. So this angina is one of the symptoms. It's very complex and unpredictable. So many times when you have this angina and reached for any treatment, you might have already heard your cardiologist would have advised you to go for a bypass surgery or angioplasty. So is it really required? This is what we are going to discuss in this video. So when you have an angina, this angina can progress or it can also stop progressing. So what the guideline or recommendation gives you is, when you have a patient with angina, they request the cardiologist to wait, watch and follow. This is a dictum how to treat angina. But unfortunately, most of the cardiologists wouldn't listen to this recommendation and they go more aggressively by indicating that you may require angioplasty or a bypass surgery right away. So altogether, if you want to put it in a simple word, the disease itself is not the aggressor, but the cardiologists are. Because the natural course of the disease, it's not as aggressive as a treatment. So when you do a treatment more aggressive, eventually you will worsen and only can able to increase the risk of complication of angina rather than reducing it. So this is what the recommendations has been come up from various guidelines, but irrespective of this, it is not followed. So what is the recommendation and how this recommendation is arrived? Now there is a study called Clarify. So from 2015, there are many recommendations has come out and said, don't intervene until it is absolutely needed, or you try to follow the approach of wait and follow. But why do they say that? Because it comes up with various evidence from multiple papers. In that, from one paper I want to quote in this talk, which is called Clarify Registry. So this took around 32,000 patients from 45 countries and followed them for 5 years. The actual target or objective of this registry is to track and find out how this chest pain behaved in a long course of 5 years. So to the surprise, what they found out is there is only two kind of management for this chest pain. So one is non-surgical. That means you don't put the patient on any surgical risk. Just give them some advice, recommendation, medication, lifestyle changes, risk reduction and adjuvant treatment like EECP to improve the blood flow. And second is a highly invasive procedures like a bypass surgery and angioplasty. So in this 5 years, they want to know how this angina resolve. So to the surprise, what they found out is in this Clarify registry is, in 1 year, almost around 40% of the patients are free of angina with this conservative management. As a year passed by, second year, third year, fourth year and fifth year, actually this angina started getting better and better. So some other studies like Courage, which has been published, clearly shows without intervention, more than 72 to 75% of the patient become anginal free. So they have better outcome. It means the risk of heart attack, death, everything significantly falls. So altogether, if you look at bypass and angioplasty, only 5% require bypass and angioplasty to relieve their angina, and remaining 95% in 5 years, they don't require this aggressive treatment, and with conservative management only they got better or their anginal symptom resolved. So from that, what we understand is, when you have a chest pain, you don't have to rush and do angioplasty and bypass surgery, because in this Clarify registry of 32,000 patients in 5 years, yes, if you have an angina, you do have a risk, but the risk is very less compared to the risk which angioplasty or bypass surgery as a procedural risk which will be placed upon. So in 5 years, in Clarify registry states only 5% have cardiac death. So this is what it's important, because most of them would go for a bypass or angioplasty thinking that they would reduce the risk. But in fact, even in the 5% who required bypass and angioplasty, there is only symptom relief, but absolutely there is no reduction in cardiac death or heart attack or stroke when you do a bypass or angioplasty, but unnecessarily you will be exposed to a high risk of procedural complications.
இருதய நோயாளிக்கு bypass surgery angioplasty சிகிச்சை முறை தான் முன்னாடி கொடுக்கப்பட்டுள்ளது. இதற்கான மாற்று சிகிச்சை முறை EECP enhanced external counter pulsation heal your heart vasomatic EECP treatment center.